All right, everybody, we're going to be talking about chapter 23, which starts on page 373 in the book, and it's the drug therapy for gastric ulcers and reflux. So that's what we're going to be talking about. All right, so in this chapter, we're going to be talking about GERD, and that's usually GERD. It's gastroesophageal reflux disease, as well as PUD, which is peptic ulcer disease. It does affect the upper GI system. It starts with the mouth and travels down to the upper part of the small intestine, which is the duodenum. So we're going to be talking about that stuff. Read about the physiology, the pathophysiology, about, ulcers and things like that, and digestion. Um, we know normally our stomach secretes thick gel-like mucus, which coats and protects the walls from stomach acid. We know acid is produced um, and it will balance with the mucus secreted. So it does a balancing thing. That's why we have no ulcers. But if that gets out of risk, if the mucus is less or the acid is more, then that can cause us to get ulcers. So that's what we have to watch for. The more acid than mucus secretions, you're at risk for tissue damage or ulcers, and that's what we do not want. Other things that can cause the imbalance, such as medical problems, there's genetic factors, there's lifestyle and certain drugs that can cause an imbalance, which can cause ulcers. So those are some things that we have to watch for. The intestinal tract does not produce protective mucus. It relies on the pancreas to neutralize stomach acid before it gets to the intestine. So that's where we have issues too. The pancreas will release buffers like bicarbonate to help with this. So if we have issues with our pancreas, then we're going to have problems. Also, we can have ulcers in the intestinal region. So GI ulcers, 10% of the US will develop ulcers. That's pretty lot of amount of people. It is a common thing that occurs. There are open sores in the mucus lining of the stomach or duodenal area. It's usually where hydrochloric acid or pepsin are located, and these ulcers are part of a PUD, which is peptic ulcer disease. The peptic ulcer in the stomach will lead to gastric ulcers. Peptic ulcers in the duodenum will lead to duodenal ulcers. You can get esophageal ulcers, which usually happens due to GERD or acid reflux, where acid actually, the acid in the stomach can actually back up into the esophagus and cause erosion and cause ulcers that way. So you can get esophageal ulcers. Now, when we're talking about H. pylori, which is the Heliobacter pylori, 80 to 90% of gastric ulcers are due to this infection, which is the H. pylori bacteria. 20 to 30% of the US has this infection present. Some have no signs and others develop ulcers from it. They do believe it's lifestyle, could be due to stress, due to diet, or just the excess acid production. An H. pylori infection has a role in ulcer production, but H. pylori is the main cause. So on box 23-1, on page 375, you can actually see some factors of the development of peptic ulcer. And you can see the acid and pepsin production, alcohol. Alcohol is really big on ulcers. Caffeine can cause ulcers. The Helicobacter pylori bacterial infection, ulcers. Non-steroidal anti-inflammatory drugs, that's why it's important to eat with your NSAIDs. Smoking and stress, all are things that cause ulcers. Remember, when we are going to treat H. pylori, we always want to make sure we treat it with 2 antibiotics and something called a PPI, which is a proton pump inhibitor. And we'll be talking about those in this chapter. Normally, you can't damage your gastric mucus, but that can change with increased gastric activity or a decrease in prostaglandins, which inhibit acid secretion and stimulates mucus and the bicarbonates. This will lead to development of ulcers, which are open sores in the stomach or duodenum, and that's what we're going to be talking about. So there are some common symptoms of peptic ulcers. Now, the big one, and we need to notify the doctors if anyone ever complains of burning, gnawing pain from the umbilicus to the sternum. Okay, pain can last minutes to hours. You get stomach acid that gets in contact with the ulcer. It happens when stomach is empty, when you eat, the food buffers the acid, or it can take an acid to decrease the acid production. So different things. It can happen at night and can go on for days or weeks. Bad symptoms of gastric ulcers, of course, would be vomiting, blood. You can have red or black, which they call that coffee ground emesis. You can have dark, bloody stools, nausea, vomiting. You can be burping a lot. You can lose a lot of weight, and you can complain of chest pain. A lot of times people complain of epigastric pain. That would be the chest pain region. Um, like I said, they do use antibiotics to treat peptic ulcer disease. Like I said, we are treating H. pylori bacteria. There's different antibiotics they will use. They will use clarithromycin, which is Biaxin, um, metronidazole, which is Flagyl, tetracycline, and amoxicillin. So those are some of the antibiotics that they will use to treat H. pylori bacteria. But otherwise, they do recommend a change in lifestyle habits, like watch the food you eat, stay away from caffeine and alcohol, no smoking, no stress. Avoid NSAIDs at all costs because they will inhibit prostaglandins. That's why long-term use will cause ulcers in the patient. So not recommended to use NSAIDs if you have peptic ulcer disease. Ulcers can heal in a few weeks with drug therapy, but other times ulcers have damaged the tissue and blood vessels. And if that occurs, then you will have big time bleeding, and that's called a bleeding ulcer. Worst case, you can actually get a hole in the wall of the stomach or the duodenal area, which will drain contents into the abdominal cavity or the peritoneum and cause infection, which is peritonitis. And that's something that we don't want to watch. So on Bax 23.2, on page 376 is actually some signs and symptoms that your ulcer is getting worse. So look at those and see some things about that. So that's that. Now, when we're talking about GERD, GERD is when liquid contents of the stomach will back up into the esophagus. It regurgitates or refluxes. Your lower esophageal sphincter, which is LES, they call it. It's very strong. It's ring muscles. It's between the stomach and the esophagus. It does help prevent stomach contents from backing up into the esophagus. When the reflux occurs, your sphincter muscle is not working right. It may be relaxed or very weak. And then sometimes due to surgery, you have to strengthen the sphincter muscle. They might have to do surgery on it. But otherwise, what happens is if that muscle is weak or relaxed, it will back up into the esophagus and cause erosion. Most common symptom is heartburn. People complain of big time heartburn, which is dyspepsia, but other symptoms, they can have bad taste in their mouth, a raw throat. They can have water brush, which regurgitation of watery acid from the stomach. Afterwards, it can happen after they eat or when they lie down or, bend over. It can actually cause some reflux. If it's chronic, it's lifestyle changes. You have to do different things to change life. If not, it's something that you're going to have to deal with, but you can do a lot of lifestyle changes. There are 5 stages of treatment of GERD, and this is on box 23.4. Oh. Yep, stages of treatment of GERD that you can look at. Example like the smoking, lost weights, small meals, elevate head of the bed 6 to 10 inches, or use wedges, don't lie down after meals, at least wait 3 hours. Big time things to avoid: food to avoid chocolate, peppermint, alcohol, and caffeinated drinks. What it does, it will decrease the pressure of the LES, promote reflux, and we don't want that. They do recommend chewing gum after meals because what it will do is increase saliva, which contains bicarbonate, and it will neutralize the acid. Plus, it will make you swallow more. So when you're swallowing, you're going to keep the material down. It's not going to be able to back up because you constantly are swallowing. So people who have GERD, they usually recommend them chewing sugarless gum just to prevent them from backing up the stuff. They'll keep swallowing, and swallowing it deactivates a lot of the acid, neutralizes it. In severe cases, you'll have bleeding, which is anemia. You can have scarring, which are strictures, and you can have change in cells. And if you change the cells of the lining, that can lead to precancer or cancer cells. So that's something to think. There's something called Barrett's esophagus, which is an increased risk for developing cancer, and it is a condition out there. Okay, so there are types of drugs for peptic ulcer disease and GERD that we're going to talk about. They're anti-ulcer drugs to treat ulcers. Okay, the first one we're going to talk about is our histamine H2 blockers. These ones will decrease secretion of gastric ulcers. They're antagonists, so they will decrease the stimulation of H2 receptors in the gastric cells, which release the hydrochloric acid from the parietal cells, and in turn will cause a decrease in gastric acid secretion. So your histamine H2 blockers will decrease gastric acid secretions. Normally, histamine binds with the receptors in the stomach wall, then leads to the acid pumps will start working and release acid into the stomach. So for blocking that action, it's going to decrease it. We do use them to heal ulcers, also to help with symptoms and pain. Over the counter, they do have those. They will be lower doses. And there's also prescription strength, which will be higher doses. So examples of that, of our common H2, our histamine H2 blockers. These are on page 379 and page 380. And a lot of these that are ones that we can remember. Let me see, famotidine or Pepcid is a big one. Ranitidine or Zantac, and I think they might have taken that one off the market. And cimetidine, which is Tagament. Nizazidine, which is Axid. We do use that somewhat, but if you notice the endings of it, tidine, T-I-D-I-N-E, those are your common histamine H2 blockers. I always remember they end in T-I-D-I-N-E, tidine, tidine, whatever you want to say. But those are some things that we have to watch. What are these meds going to do? Well, we expect them to decrease acid secretions. We do expect them to decrease the GERD symptoms, and we do expect them to help heal ulcers. So that is the job of these medications. But they do have side effects, and those side effects are going to be located on page 380 in the little box. A lot of neurological issues. So we do have to watch for the neurological status. So most common, confusion, dizziness, drowsiness, headache, and then nausea and vomiting. So it's going to be most important to make sure that we watch and monitor the patient's neurological status. We should know what they are acting before as well as how they're acting after, but neurological side effects as well as nausea and vomiting. Now, if you're taking ranitidine or Zantac, a harmless side effect of it is it does cause a blackened tongue and dark stools. So that is not uncommon with ranitidine or Zantac. And if you're taking nizazidine, which is Axid, or cimetidine, which is Tagament, it can actually cause drug-induced hepatitis. So we do have to watch for that. Now, adverse effects for these drugs, they do cause dysrhythmias. They will decrease your white blood cells, so we know puts patient at risk for infection, can cause anemia, so you have a decreased blood cell production in the bone marrow. So that's not uncommon for that to occur. So what do we want to do before we give these? We always want to make sure we have a baseline level of consciousness because we know the side effects of drowsiness, confusion are common. We want to make sure we give these drugs with meals to prolong the effects. If you get the med daily, then give at night so it will help with when the reflux is worse. If we're giving it IV, check the site at least every 2 to 4 hours for any type of infection. Afterwards, we're going to make sure we give them the call light, tell them to please use assistance because they're at risk for being dizzy or drowsy. And we want to watch for the other side effects or adverse reactions and look for any signs of bleeding. We want to make sure we teach our patients that if the over-the-counter is not working for more than 2 weeks, then see a doctor. These should be for short-term use. So if you're taking over-the-counter and it's not working for 2 weeks, call a doctor. And another thing that you may want to rule out that you don't have stomach cancer because some of the symptoms for GERD and peptic ulcer disease are the same as cancer. So they may want to rule that out. Stop smoking if you do smoke because it will interfere with the action of the drug. And watch certain activities, especially driving and that safety concerns because of the due to drowsiness. So we want to be careful with that. Pregnant and lactation or breastfeeding, I hate that word lactation. Low chance to cause birth defects and fetal harm. Not studied much in the pregnant population. Um, Pregnant people are famous for having heartburn, so a lot of lifestyle changes can be taught to them. And definitely tell the physician if you're having any problems. Uh, and it can pass through the breast milk, so breastfeeding is probably not a good option. Now, older population, those are the ones we're going to see a lot of safety issues, especially increased chance of confusion and dizziness because they're very sensitive to the drug. So we need to watch them because they can fall. We have to watch them changing their position. No driving until they check out the side effects that occur. So we do have to remember that. So that is something to look at. Now, the second thing we're going to talk about is our PPIs, or proton pump inhibitors. These ones actually block the secretion of that gastric acid. They block the action of the pump located in the acid secreting cells, which blocks the stomach acid secretions. We do use them to treat peptic ulcer disease and GERD. They're used for a limited time when histamine H2 blockers didn't work. So this is our second choice. You can find them over the counter or prescription, and that's on page 381. Omeprazole, we give a lot of omeprazole or Prilosec. Lansoprazole or Prevacid is a common one. Omeprazole or Acifex, we do use that. Pantoprazole, Protonix, and also methoprazole, magnesium, Nexium. Those are some famous ones that we do use. And if you notice, they end in prazole. You notice all of them have prazole in their generic name. So that's an easy way of remembering them. With these ones, like I said, their expected response, they will decrease the secretion of gastric acid, they will decrease acid reflux, and they will help heal ulcers. Side effects are rare, but they do occur, and those are on page 381. The common ones for our side effects, of course, diarrhea or constipation, gas, abdominal pain, and they can have a headache. So there's abdominal issues and a headache. Some say they just feel ill when they're on the medication. Long time use can actually cause stomach infections because you're not producing acid to kill the bacteria of whatever you're putting into your stomach. So a lot of times they can have infections in long-term use. They can have anemia because decreased stomach acid, decreased digestion of protein, which is needed to make new blood cells. So there's an issue with that too. So long-term use, stomach infection, and anemia for long-term use. Adverse effects for PPIs, allergic reactions are rare but they can cause dizziness, photosensitivity, some mouth dryness, blurred vision, pain in the joints. We want to make sure we give these before meals in the morning. They can be given with antacids. You can give with or without food. And IV, you always want to make sure you check the site that it's good. Afterwards, we want to report any black tarry stools because that could be an increase in the GI problems, which could be hemorrhage. So definitely if they have any type of black stools, we want to make sure that we send out for an occult blood stool specimen to make sure that it is actually blood. Some of the medications like omeprazole can cause dizziness, so safety is going to be a big issue. We want to make sure we teach our patients, take it as ordered, even if you're feeling better. Remember, do not cure the ulcer, but it will change the environment so healing can occur. If you stop the med before the treatment, then you may not have a completely healed ulcer and have problems again. Report black tarry stools, diarrhea, pain, a constant headache. These are all signs and symptoms that there could be some bleeding occurring. Drugs can cause dizziness, so watch driving or positional changes. And they do recommend wearing sunscreen. Can cause some photosensitivity. So that is some things we have to watch for too. Pregnancy and breastfeeding. There's some birth defects that can use. Some are okay. Just talk to your OBGYN in regards to that. Now, our older adults on PPIs, increased risk for side effects, increased risk of hip fractures due to decreased calcium absorption, decreased absorption of vitamin B12. So they need to take a daily multivitamin when they're taking PPIs because of the decreased calcium absorption and the decrease of vitamin B12. And if they stop the drug when the ulcers or inflammation is healed, they should stop it. When they're healed, inflammation's gone, then they should stop it. But that would be something to discuss with the physician when you can do that. And safety, it's going to be our big concern for our older population on that. Now, our third thing we're going to be talking about now is our antacids. And we talked about antacids 1 hour before, 2 hours after a lot of drugs. Antacids actually neutralize acid in the stomach. It will decrease the irritation and inflammation in the mucosa. We give it for heartburn and indigestion. Given by mouth, you can buy it over the counter. And on page 383 is some of our common antacids. We have magnesium hydroxide, aluminum hydroxide, simethicone. Those are all different types of antacids that we use. Then we have, which would be Maalox, Milkamag, which we call Mom, or Mylanta. Then we have our aluminum hydroxide, which would be our Amphigel. And then we have calcium carbonate, which is our common Rolaids Tums that we take over the counter that a lot of people do. These medications, they will neutralize the acid. Our goal is to no heartburn or indigestion. They will decrease GERD symptoms and they will promote ulcer healing as well as pain. But they do have side effects. They are rare, but they do occur. And those are on page 383. Only happens if you take many doses or over a long period of time, or you can have kidney disease that you're going to have a lot of side effects. But it does cause constipation, and especially in the drugs that contain calcium or aluminum salts. Diarrhea occurs with anything that contains magnesium. We've talked about that before, how magnesium causes diarrhea. But the common side effects are constipation, diarrhea, decreased appetite, weakness, and fatigue. Okay, and on 23.2, you can see the more of the different things, because some can cause bone pain, problems urinating, so you can look at those things, but we're just going to focus on the common ones right now. Now, adverse effects of our antacids, it's not reported only when taken correctly, but if you do take it incorrectly, then you can have issues with it. What we're going to teach our patients, give it 1 hour before or 2 hours after the drug, because it will interfere with a lot of different meds. What we're going to do is we're going to make sure we ask them afterwards, did you get relief? We're going to check their bowel movements. We want to make sure we don't see any bloody stools or those black tarry stools. We're going to be checking for that. We're going to teach our patients, call the doctor if you take more than 2 weeks without relief, because it could be heart problems. Because like I said, a lot of times people complain of epigastric pain and they think it's their stomach and it's actually their heart. So if you're having it more than 2 weeks, we're going to definitely make sure without relief, we're going to notify the doctor so they can work you up and check you over. Kidney problems can get worse with long-term use. You can get actually kidney stones when you're using the calcium-based antacids. Take at least 1 hour before meals. Heart failure, some antacids that contain sodium, like your Alka-Seltzer. Remember, sodium in water, you'll hold on to it, retain it, which will increase the workload of the heart. So heart failure patients should not be taking any antacid that contains sodium. And that's important. It does cause diarrhea or constipation, and we know with constipation, high fiber diet, exercise, lots and lots of water, dehydration. We want to make sure that you take some fluids so you don't dehydrate with diarrhea. And our pediatrics, we really shouldn't give it to younger kids unless prescribed by a doctor, because it can change their pH of their blood, and that could be an issue. Pregnant and breastfeeding, notify the OBGYN about that. Remember, be careful with the sodium containing ones because you contain a lot of body fluid with that. So always talk with your OBGYN, which is best to take in our older population. No aluminum containing antacids because it will cause bone problems. And think about our Alzheimer's disease. They think that Alzheimer's disease is due to aluminum because the only way they can tell is when they cut open your brain if there's aluminum parts in there. So anything that contains aluminum, we do not want to give it to any of our older population because of the bone problems, and it can cause issues with Alzheimer's disease. It can make the condition worse, and that's what we do not want. So that's why we would do, not want to give that. Now, the fourth one we're going to talk about is our cytoprotective drugs, and these are our GI coaters. They form a thick coating that actually covers an ulcer to protect the open sore from further damage, and if we protect it, it will allow it to heal. You can buy over-the-counter ones, bismuth subsalicylate, which is Pepto-Bismol. That is actually a cytoprotective drug. And there's also prescription ones, which is our sucralfate, which is Carafate. Sucralfate, which is Carafate, it coats the ulcer, not normal stomach mucosa, which promotes the healing of the ulcer. So it just forms a coat over it. Pepto, on the other hand, coats the stomach and intestine, protecting the wall lining. It inhibits the activity of H. pylori and decreased GI infections. So sucralfate will just cover the ulcer. Pepto will cover the entire lining of everything. The goal of it is, of course, to heal the ulcer and protect the ulcer and prevent more damage from the tissues from occurring. And you can see those meds on 385. And we give a lot of sucralfate or Carafate. Now, side effects for these, constipation and abdominal discomfort. They're rare, but they do occur. Sucralfate can cause constipation. And like I said, dizziness, drowsiness, diarrhea, dry mouth, rashes, gas, and digestion, nausea. But constipation and abdominal discomfort is the two major side effects. Adverse effects, none reported. Nothing has been reported about it. So nothing that we have to worry about. What are we going to do before? We're going to make sure we do an assessment for the drugs on, the peptic ulcer disease or GERD. We're going to make sure that we have the correct stuff. We're going to make sure we see afterwards some change. Are they having any help? Is things getting better? We want to make sure we teach our patients the precautions related to the medications to peptic ulcer disease and GERD, like the bloody stools, vomiting blood, things like that. We want to make sure they take the medication as prescribed and for the full duration. And the full duration can take 4 to 8 weeks. 4 to 8 weeks. They have to maintain it. They can't stop it because otherwise the ulcer is not going to heal. So it can take up to 4 to 8 weeks for full treatment. We do encourage them to increase fluids, fiber, and exercise to prevent constipation and abdominal pain and discomfort. Pregnant and breastfeeding, talk to your OBGYN. And so that is the cytoprotective drugs, but very important they maintain it for 4 to 8 weeks. Now, the last but not least is our pro-motility drug. And we actually talked about it in the last chapter to help with nausea, but it is used to treat GERD and increases your sphincter tone and increases food emptying out of the stomach. And that is metoclopramide or Reglan. It will increase peristalsis, which moves the food along and moves it out quickly, so less chance of it to back up. It helps to treat GERD. We usually give it 30 minutes before a meal, and usually you're on it for 4 to 12 weeks. It's used to manage gastric or duodenal ulcers. And normally, like I said, it's normal for us to have that abdominal gurgling because it increases peristalsis to get the food out. So that's very important for us to remember. Also remember with metoclopramide, the depression issues. If they complain of depression, then we need to notify the doctor about that. And we talked about that in the last chapter. And then last part about that is the antibiotics, which I already told you about H. pylori. So basically that's it for chapter 23. Any issues, call me and we will, discuss.